This surge is forcing some hospitals to postpone elective surgeries. On your side's Kaylee Tracy spoke with a cardiologist today. She joins us live tonight. So Kaylee, what did he have to say about the status of surgeries?
Well, Dr. Michael Corney is part of a practice of cardiologists that travel to hospitals in the area. He says that resources, including nurses, have been pulled from those operating rooms and they've been put into COVID wards, and that is forcing them to postpone some of their elective surgeries.
Oh my gosh, yikes. It's very frustrating.
Cardiologist Dr. Michael Corney describing the current spike of COVID-19 in Jacksonville.
The number of cases, I think, would be a lot less, quite frankly, if more people had taken the advantage of getting the vaccine. Unfortunately, we weren't able to get as many people vaccinated as we'd like to, and so that is a source of frustration.
The current case is creating frustration and forcing him and other doctors to postpone elective surgeries, Corney says.
Literally, at this point, we just don't have enough resources, and staff being the most important thing. There are some staff members that are not able to work because they have infections, of course, as part of the issue, many of whom are also unvaccinated. But we're really struggling to keep up with the staffing needs. And when you have that situation, the first thing that you have to defer are the elective procedures.
It's not the first time they've had to do this. Corney says they put some surgeries on hold during the spike in May and June of last year.
A part of that was because we just didn't know how to manage things as well. We're much better at managing them.
But now, he says, hospitals are the most crowded they've been at any point of the pandemic.
There are more resources, including nurses and other staff members, who are being moved from operating room service or other service in the hospital to the emergency rooms and to the COVID wards.
He says he wants to reassure people that if there's an emergency, the procedure will be done. If it can be put off, Corney says, the procedure will be postponed for weeks, even months. And Corney says he expects this postponement of procedures, elective procedures, to last at least a few more weeks through this current spike. Now, I do want to tell you, we reached out to our local hospitals and asked them if they are postponing elective procedures as well. UF Health says it is rescheduling elective procedures where you have to stay 2 or more nights in the hospital. Mayo Clinic and Baptist both said they're taking it on a case-by-case basis. And if you don't hear from your doctor, then you should expect that it will go on as scheduled. But we'll be sure to keep you updated on air and online. For now, reporting live, Kaylee Tracy, First Coast News, on your side.